Hello, everybody, and welcome to the MWay podcast brought to you by the Institute of Clinical Excellence. My name is Annoushka, and I'm a doctor of physical therapy and member of the Modern Management of the Older Adult Division of the Institute of Clinical Excellence. In light of May being Stroke Awareness Month, we're going to talk about stroke rehab. For decades, post-stroke physical therapy followed a pretty predictable blueprint. The traditional focus was on teaching compensatory strategies, basically learning how to get by using your stronger side. Therapy sessions prioritized slow, perfect movements, and there was this general disheartening acceptance in the medical community that most functional recovery just sort of plateaued after 6 months. But the latest clinical guidelines and neuroscience have flipped the script. Today, we're diving into a massive paradigm shift. We're talking about high-intensity, technology-driven, and truly progressive therapy practices that are redefining what recovery actually means. The brain is far more resilient than we used to give it credit for, and the new era of rehab is proving it every single day. Let's start with the biggest shakeup happening in neuro rehab clinics right now: how we train walking. Historically, if you watched a stroke survivor in physical therapy, their session was quiet and deliberate. The goal was normal-looking walking. If a patient hitched their hip or dragged their toe, the therapist would stop them, but they also focused on keeping their heart rates relatively low to prevent fatigue. But the most recent clinical practice guidelines say we should be doing the exact opposite. Enter high-intensity gait training. With high-intensity gait training, we aren't prioritizing a beautiful, pristine stride right out of the gate. Instead, we are prioritizing cardiovascular intensity and sheer volume of repetitions. Modern therapists are pushing patients to 65 to 85% of their heart rate reserve. They're walking fast on treadmills, navigating obstacles, walking backwards and sideways, and climbing stairs. Now, you might wonder, why push someone so hard when they're already struggling with balance? It all comes down to the biological process called priming. When you push the cardiovascular system to those higher zones, the brain releases a specific protein called BDNF, or brain-derived neurotrophic factor. It physically primes the neural environment for neuroplasticity, which is the brain's ability to rewrite and forge new neural pathways around the damaged area. If you aren't hitting those high intensities, you aren't releasing enough BDNF, and you're leaving recovery on the table. This also means that we have to change how we view mistakes. In modern PT, error is not the enemy. Error is actually necessary. The human brain learns movements by making a mistake, detecting it, and correcting it. If a physical therapist holds a patient up so perfectly that they never lose their balance, the brain never learns how to stabilize itself. By using safety harnesses and smart spotting, we can keep patients safe while still letting them work incredibly hard. This idea of pushing boundaries brings us to our next major shift: technology. Robotics and virtual reality are becoming foundational elements of cutting-edge stroke rehab. And they are solving the single biggest hurdle in physical therapy, which is dosage. Neuroscience tells us that in order to truly map a new movement in a damaged brain, it takes hundreds, sometimes thousands of repetitions. But think about a standard 45-minute therapy session. Between resting, adjusting, and manual guidance, a patient might only get 30 to 100 steps or reaches. It's simply not enough to force the brain to reorganize. But when you introduce robotic-assisted gait trainers or upper limb exoskeletons, a patient can easily get over 1,000 repetitions in a single session without fatiguing the therapist. Then we have virtual reality. Virtual reality isn't just about making therapy fun. It taps into a powerful psychological concept called gamification and augmented feedback. Imagine a patient who needs to rehab their weaker arm. If you ask them to lift that heavy, uncooperative arm overhead 50 times in a row, they're going to get frustrated or bored by rep 10. Their focus is entirely internal. They're thinking about how heavy their arm feels or how hard it is. But If I put them in a virtual reality headset where they are suddenly a goalie blocking soccer balls or they're reaching out to pick virtual apples from trees, something incredible happens. Their brain shifts to what we call an external focus of attention. They stop focusing on the mechanics of their shoulder and start focusing entirely on the goal of the game. Research consistently proves that when the brain focuses on an external goal rather than internal mechanics, motor learning is deeper, faster, and sticks around much longer. But perhaps the most important shift in this modern physical therapy or occupational therapy isn't a piece of technology or a specific exercise protocol. It's a shift in mindset. For decades, stroke survivors were given a devastating timeline. They were told, whatever recovery you get in the first 6 months to a year is pretty much all you're going to get. It created a ticking clock mentality that caused an immense amount of anxiety and despair. Well, I'm incredibly happy to tell you that the latest neurological literature has officially debunked the hard 6-month plateau. Here is what's actually happening right after a stroke. The brain enters a phase of spontaneous recovery. The brain is naturally hyperplastic, trying to heal itself, and this window does start to slow down after a few months. But, and this is the crucial distinction, the brain's ability to learn through directed experience never stops. This means a stroke survivor who is 5, 10, 15 years post-stroke can still see general functional improvements. We see this clearly in studies involving chronic stroke patients who undergo intensive task-specific training. A great example is constraint-induced movement therapy, where the patient's stronger hand is restricted in a mitt, forcing them to use their weaker hand for hours a day. Even years after their stroke, these patients show significant changes in their brain mapping and measurable improvements in their daily independence. This historical plateau wasn't a biological limitation of the human brain. It was a limitation of traditional therapy, durations, and insurance cutoffs. The brain remains adaptable. If you provide the right stimulus, the brain will respond, no matter how many years have passed. So the takeaway from all of this is clear. Neurological recovery is a lifelong journey, not a sprint with a rigid deadline. If you're a clinician listening to this, I challenge you to up the intensity and embrace the errors in your sessions. Safe, high-intensity, meaningful practice is the key to unlocking your patient's brain's hidden potential. If their rehab session feels like a casual stroll or a light, easy stretch, it might be time to develop a more progressive, challenging program. Push those boundaries because their brains can handle it. Thank you so much for tuning in. If you're interested in learning more ideas on how to manage complex patients, join us for a live course or online, which you can find on ptonice.com. Also, click the link below if you want to stay up to date on all things geriatric in less than 3 minutes every other week. Join our free MMOA Digest email list. And thank you for joining me today.